Onc Live Insights is a video editorial program produced by Onc Live.
Now, in stage 4 non-small cell lung cancer, a platinum-based doublet is standard of care. The partner to the platinum is often dictated by other considerations. For example, in patients with adenocarcinoma, aka the non-squamous population, the more commonly used agent as a partner to the platinum analog would be pemetrexed. Pemetrexed has been shown in a couple of studies to be more effective in patients with non-squamous non-small cell lung cancer histology. So if a patient walks into clinic and has a non-squamous tumor and we deem that patient to be a great candidate for platinum-based chemotherapy, of course these are patients who don't have actionable molecular drivers. So these are patients who are wild type for EGFR and ALK and ROS and therefore are candidates for platinum-based therapy. We often offer those non-squam patients with platinum-based chemotherapy that includes either pemetrexed or a taxane. Those are considered standard of care. We also consider whether to add bevacizumab to that combination because bevacizumab had been shown in a prior study to prolong survival when combined with a platinum-based doublet. And in that trial, it was carboplatin and paclitaxel. In patients with squamous cell histology, there's still a large unmet need in trying to define the best or most optimal regimen for that patient population. What we do know is that in patients with squamous cell carcinoma who have stage 4 disease, the platinum doublet should not include pemetrexed. That's the best we could say about the data at hand. There are other possible combinations for patients with squamous cell carcinoma. There are other possible doublets that we can offer to patients with squamous cell carcinoma. These include carboplatin or cisplatin with paclitaxel, gemcitabine, or nab-paclitaxel. Docetaxel can also be used as part of that platinum doublet. The key here is that we use histology in this day to help differentiate which patients should receive a frontline doublet that contains either pemetrexed or a taxane, and we tend to use other doublets for those with squamous cell histology. It is interesting to note that at this year's ASCO meeting, a large randomized trial of a platinum-based doublet with or without an EGFR monoclonal antibody, necitumumab, was reported to be positive. And this was a positive trial in squamous cell histology. The benefit seen was fairly modest. The hazard reduction was very small, but nevertheless, this was one of the first trials ever done that showed a benefit for a targeted agent in combination with cytotoxic chemotherapy in the unmet need subset of squamous cell carcinoma. We are, of course, waiting for that drug to be commercially available. We anticipate that the new agent, necitumumab, will be submitted to the Food and Drug Administration for approval for its use in squamous cell carcinoma of the lung. And if it's approved, then it provides an option for patients with that disease, although one must couch the benefits of that agent in the modest realm of what we saw as it had been presented. It does prolong survival, but very modestly, and it's not quite getting us to the benefits that we expect nowadays from our new agents. Nevertheless, it was a positive trial, and I think it will be an option for our patients with squamous cell carcinoma.